The following video is a demonstration of how to administer naltrexone extended-release intramuscular injection. This content has been created by the UPMC St. Margaret Family Medicine Residency Program in Pittsburgh, Pennsylvania. The creators of this presentation have no disclosures. Please consider reviewing this disclaimer slide prior to proceeding with the rest of this video. The content of this video only covers preparation injection of naltrexone. The following three additional resources also demonstrate and provide information to that regard. The first is from SAMHSA, and it is a comprehensive guide to naltrexone. The second is a video demonstrating real-time naltrexone preparation and injection. The third is a video from the drug company demonstrating naltrexone injection and preparation as well. There are several steps to consider prior to intramuscular injection of naltrexone. This video only covers the injection process itself, not patient selection or other factors that should be considered prior to naltrexone injection. Patient selection is the most important criteria. Please review this in other resources. However, you want to verify that the medication that you have is for the correct patient. You do want to ensure that the patient has not taken any opioids at minimum 7 to 10 days prior to injection, preferably 14 days. You would like to have a documented negative urine drug screen for opioids, a recent negative urine pregnancy test, and LFTs that are not significantly elevated or indicative of chronic liver disease such as cirrhosis, which is a contraindication to naltrexone. An oral trial of naltrexone is preferred. The patient may have previously received intramuscular injection. Both of these may be something that you want to consider verifying in the patient's history prior to injection, and ensuring that the patient's vital signs are stable and that there's no other contraindications to the injection. This is what the naltrexone box looks like. It will have been removed from the refrigerator for at least 45 minutes prior to administration, but it can be out of the refrigerator for 7 days prior to use. When you open the box, you'll find two pieces of paper. The first is a medication guide that you should provide to patients regarding the medication. The second is a directions for use and package insert. This will be useful to review if you need a reminder on protocols of administration. Then you should remove all of the contents of the box. This will consist of two 2-inch needles, two 1.5-inch needles, a preparation needle, and a 5 cc syringe. There should be 2 vials remaining in the box. The first is a diluent white-capped bottle that is going to be injected into a blue-capped powder bottle that is the naltrexone microspheres. The medication is actually the powder, and the diluent will provide the suspension that will be injected into the patient. Examine each bottle, but particularly the powder bottle, and move it around, ensuring that the powder is loose and free and there is no significant discoloration associated with the powder itself. Finally, prior to administration and preparation of the medication, you will want to remove the caps for each vial and swab them with an alcohol swab. Plan to undertake the next steps once the patient is roomed. Preparing the medication too early can lead to difficulty during administration. Take the preparation needle, attach it to the 5 cc syringe, and then draw back approximately 4.2 cc's of air. Inject the air into the diluent bottle, which will make it easier to remove this viscous liquid, and try to angle the needle tip towards the base of the bottle. Take the diluent and inject it into the microspheres bottle. Once this is complete, you're able to cap the needle and dispose of the needle in the sharps container. Proceed to shake the vial after the suspension has been created for at least 60 seconds. The final mixture should be milky white and not contain any suspended particulates. If necessary, you can tap the bottom of the vial to loosen up any solids that might be at the base. Prior to administering the medication, you will need to have the vial containing the medication that has been mixed for at least 60 seconds, the 5 cc syringe, 2 needles that are appropriate sized. Most patients will use the 2-inch, but thinner patients or patients with less adipose tissue will use the 1.5-inch. You will only need 1 needle for administration. However, a backup should be maintained in case there is problems during administration, such as clotting. 2 non-sterile gloves and alcohol swabs, a 2x2 for hemostasis and rubbing the medication in, and 1 Band-Aid. There are several questions you will want to review with the patient prior to administration. First, if there is any new substance use. This obviously will be important for any opioid use. However, any substances, including alcohol, smoking, or other illicit substances, are important to document. Also, it's important to note and document any new medications. It's important to ask the patient which side they received their last injection and confirm this against the chart. You will be injecting into the contralateral side. So if the patient last month received their injection on the right buttock, you will be injecting into the left side. Always query if the patient had any issues with their last injection. We always ask the patient if they would like their injection to be administered standing or laying on the examination table in the prone position. There's no significant advantage to doing one way or the other. It is contingent on patient comfort. We always ask the patient if they would like a chaperone present during the administration. You may want to develop a protocol where this is the default, but we ask the patient as their comfort is imperative. There is not a significant amount of exposure associated with the injection. However, it is important, again, to ensure patient comfort. Finally, we like to ask the patient prior to administration how they would like to have the needle inserted. Some patients prefer not to know that the needle is going in. Others like to receive a warning of 1, 2, 3, or just clean and inject. It's important to ask this for the patient's comfort. Please wear gloves for all aspects of administration when interacting with the patient. The first step is to clean the top of the suspension vial using an alcohol swab. Attach the appropriate size needle and then proceed to drop the medication into the 5 cc syringe. You will be injecting 4 cc's into the gluteal muscle of the patient. And so you should locate where you will be doing the injection by considering dividing mentally the muscle into 4 quadrants and locating the muscle in the upper outer quadrant opposite to the side where the patient would have received their previous injection. If the patient has not received a previous injection, you can ask them which side they would prefer to receive their first injection. Locate a spot in which you will be performing the injection. Once you have located where you are going to inject, proceed to cleaning the location with an alcohol swab. Then inject into the gluteal muscle in one smooth motion. Remember to ask the patient prior to this how they would like to be informed of the injection. 1, 2, 3, and then inject, or just clean and then inject. If you meet resistance in the form of bone or other hard structure, pull back slightly and then proceed with the injection. If the injection clogs or you are having trouble administering during the injection and meeting significant resistance during pushing the plunger in of the syringe, then pull the needle out of the patient, exchange it for the spare same size needle, and then resume administration in a location near the previous site. You may not want to go exactly the same spot, but again, upper outer quadrant of the gluteal muscle. Once the injection of 4 cc's of medication is complete, remove the needle and syringe from the patient and cap the needle immediately. Apply a 2x2 the injection site, and this is to prevent any significant bleeding, although this is uncommon. followed by a Band-Aid at the site. You're welcome to rub the medication in using the 2x2, although this is not necessary. Then proceed to take the needle and syringe and dispose of it in the biohazard sharps container. The injection is now complete. Counsel the patient on a 1-month, 28-day follow-up. Warn patients about opioid overdose and to contact you if they have acute pain issues regarding treatment. And please see additional information regarding the documentation and billing of these naltrexone injections.